A very good evening, hello and welcome to ZiFM City. Welcome to our program, our talk time. My name is Perfect Hlongwane, and tonight we want to be focusing on COVID-19. So the outbreak of the coronavirus in Wuhan in China late last year, and it spread across the country and across the globe, has been characterized by a number of myths and misconceptions on treatment. Issues like who is prone to infection, with some saying that black people are immune to the virus. Some said that the virus will not be coming to Africa because of temperatures, while others thought that it was a case on particular continents. There also have been misconceptions on COVID-19 and HIV, especially on treatment, where people have been saying that those taking antiretroviral drugs are covered because the drugs also treat coronavirus. And statistics indicate that COVID-19 has claimed over 2,551,000 lives across the world, with infected people at close to 3,687,773 people, and almost every non-race on earth has been affected. We are going to be focusing tonight on the myths and misconceptions as we aim to enlighten people about the pandemic. To help us do that, we have invited Dr. Vimbai Mandizvidza, a medical doctor and a public health specialist, and she works with the Zimbabwe Association of Church-Related Hospitals, ZACH. And remember that this program is brought to you by that organization, the Zimbabwe Association of Church-Related Hospitals. Welcome to the program, Dr. Mandizvidza.
Thank you so much for having me.
And for comments and questions, for those that want to send in your comments and questions, you are free to do so by sending in on our WhatsApp number, which is 0731168045, 0731168045. If you have any questions that you have that Dr. Mandizvidza will be happy to answer to. So as we're beginning, Dr. Mandizvidza, let's start by asking you to give us your understanding of COVID-19 or coronavirus.
So this is a new virus that's affecting people around the world.
Yeah.
It's because it's a new virus, we don't have a lot of evidence around it, especially for people living with HIV. So a lot of myths around that are just that, myths, because we don't have a lot of evidence to support those things.
Yeah. So like you have rightly said, there are a lot of misconceptions, a lot of myths around coronavirus. Some have been claiming that it only affects white people, and that black people are not, especially Africans, are not affected or infected by the virus. Could you at least help us demystify that?
There's also no evidence to support all that. Black people are just as, they're at risk of contracting coronavirus as any other race around the world. Yes. So they're including, the issues about it being, it doesn't affect people in hot climates. That is not true, as we have seen with the figures coming out of Africa.
And looking at the work that your organization ZACH does, we understand that you focus mainly on HIV and AIDS. Probably the next question I would ask you is, we also understand that people with chronic conditions are at risk of contracting the virus. How bad is it with people living with HIV?
Well, actually, people with HIV are not, currently there's no evidence to support that people living with HIV are at a higher risk of contracting coronavirus compared to the general population, or have maybe to say worse complications if they do contract coronavirus. So at the current moment, there's no evidence to support that. But we do encourage that, in addition to having a balanced diet, rest and exercise, reducing stress. We want people living with HIV to be as healthy as they can be. So they need to stay on their medications. to reduce their viral load concentration and have viral load suppression.
And because people with living with HIV and some people with chronic conditions, we have seen that there have been reports that people with underlying conditions, especially when they are infected by coronavirus, they are likely to die as opposed to someone who does not have an underlying condition. Is that the case with HIV and AIDS?
So yes, they have found that people like the elderly, people with underlying conditions like cardiovascular diseases, hypertension, diabetes, they are at risk of having a more serious infection of coronavirus, and their mortality rates are a bit higher. So I would suspect that if a person living with HIV has these conditions, they could be at a higher risk because of those underlying conditions.
And the issue that antiretrovirals themselves, they cure coronavirus.
Currently, there is no cure for coronavirus, but scientists are working very hard on that. But at the moment, there is no cure for coronavirus, and there's also no evidence to support that antiretroviral treatment cures coronavirus.
And what measures would you suggest that people living with HIV take or observe to ensure that they are not exposed to the virus?
So this would apply to people living with HIV as well as the general population. So washing hands frequently, I think we've been told that quite a lot. Washing hands frequently with soap and water or alcohol-based hand sanitizers. Don't touch your face, your mouth, your nose, your eyes. Maintain physical distancing. So it's at least 1 meter at all times. And more recently, we're being advised to wear a mask or a face covering when you're going out in public.
Yeah. And speaking of social distancing, Doc, we know that this is one of the ways that is recommended to minimize transmission of the coronavirus. People living with HIV are required to visit healthcare centers and or clinics so that they collect their monthly supplies of ARVs. As a public healthcare expert yourself, don't you think that this exposes them to the virus? And what do you think needs to be done to ensure that they don't frequent those spaces?
So with the current COVID-19 pandemic, we are advising that people living with HIV limit their clinic visits unless it's like absolutely necessary, in which case they should at least first call the health facility, make an appointment so that they can make arrangements for their visit. But to limit their clinic visits, we want them to get medication. So we're calling it month-to-month dispensing. That's what it's called. So at least 3 months supply, up to 6 months supply of medication, so that they always have their medication with them and they take their medication so that they're virally suppressed. And if they do have to go to the clinic, like I said before, they need to make arrangements beforehand. They call, they text, WhatsApp, make arrangements to go to the clinic, maintain social distancing at all times when they are there. And maybe the health facilities can also implement staggered appointments. So instead of having everybody come at 7 a.m. in the morning, they could have people come, a few people come at 7, some come at 8, come at 9, so that we have fewer people at the health facility at a time.
How has been the situation like? We understand that your organization does work with people living with HIV. At the moment, how has been the situation? Have they been going to those health care centers every month or?
So the multi-month dispensing, we have been trying to institute this from before. We have been trying to kind of limit their interactions with the health facility. So if a stable patient, they get medications to last them at least 3 months. So at the moment, there weren't a lot of patients that were getting month-to-month medications. But for those that like the unstable patients, they would still need to get at least 3 months supply, and then we could support them, virtually, either through phone or text or WhatsApp, and we can support them that way so that they can adhere to their medication.
And as an organization, what programs are you running in the fight against the spread of coronavirus?
So we do have our HIV prevention care and treatment support program, which we've been working with, especially with the mission hospitals. We're the medical arm of the Zimbabwe Heads of Christian Humanity, so we work a lot with mission hospitals around the country, mainly in rural areas. Then we also have the Faith Community Initiative, which is a program, a new program that we're working with the Ministry of Health as well as the city of Harare. Currently, we're trying to implement community posts, which are like community outreach programs, to kind of decentralize services to the communities.
Our WhatsApp number, once again, is 0731168045 for those that want to send in your questions. I see some listeners here, you've sent in questions. Doc, I'll be reading some of the questions and allow you to respond to the listeners. Someone is saying that there is evidence coming out here in the UK. This one is sending from the UK, showing that mortality is higher amongst black people from black and ethnic minority groups. What would you say about that? Many thanks and stay safe.
Well, I think we'll have to look at that study as well and see, how, what kind of maybe underlying conditions, any other confounding factors that could have led to those. But I would love to look at that.
And this one is saying that is there medicine so far for COVID-19? And you've touched on this one, but probably one would want to know. We have seen also in reports that Madagascar is also doing something in testing their medicine and actually even issuing out that medicine. Do you have anything to say about that?
I think that it would be important to properly test those out, especially for people living with HIV. Their medications, there could be interactions with certain. There could be interactions with certain maybe herbs or other medications. So it would be important to find out what kind of ingredients are in those drugs and if they have any drug interactions with the antiretrovirals. So I think it would be important to look at that.
And another one says, what is the effect of the new remedies treatment on people with HIV? Remedies that are being taken as treatment on COVID-19? We've had some people suggesting that chloroquine, some people suggesting other medicines.
Well, at the moment there is not enough evidence. Like I said before, this is a new virus that's that we're finding in humans. So a lot of the evidence is quite scarce. We don't have enough evidence to support some of these claims.
And this one is asking how important is issues of diet on coronavirus, especially when you then look at people with HIV.
Well, I think in terms of diet, it's important to have a healthy diet, I think, in general. So I think at the moment we're just trying to have people be as healthy as they can be. So I think diet does play an important role in terms of being healthy. Yeah.
Yes. So Doc, as an organization, you have facilities, like you indicated that you are the health arm of the church denominations in Zimbabwe. Have you facilities that are targeted for COVID-19 isolation and treatment, or that you have identified as an organization to say these facilities will be for isolation and treatment? We understand that the government has said that the private sector could also have those, but only if the government has approved.
At the moment, we do not have isolation facilities. We are working quite closely with the Ministry of Health so that we can get any potential contacts to the government-specified isolation facilities. So as an organization, currently we do not have our own isolation facilities, but we are implementing a lot of infection control so that we, limit exposure and spread.
And the exposure control that you are taking, is it on the facilities that you have, or?
Yes, at the moment we are limited to the facilities that we are supporting. Yes.
Okay, so another one says, what's the use of a face mask? From a health expert, why should we put on masks? That's what this question is saying.
Okay, so the rationale behind the masks is just about secretions, respiratory hygiene. So we don't want to be exposing each other to potential risk. So if everybody is wearing a mask, then we can limit exposure if there is a potential source somewhere in the community. Yes.
Yeah. Another comment here says that chloroquine has not been approved by the World Health Organization. Those are just trials. When sufficient evidence to prove it, then it can be taken abroad. Okay, so looking at the coronavirus, you rightly said that it is a new virus, it is a new pandemic. Do you also engage the community that you work with to make sure that you have awareness programs on the pandemic?
Yes. So I mentioned the Faith Community Initiative Program initially. So we're working with faith and traditional communities in HIV prevention, treatment, and support. But we're also using that channel to disseminate messages around COVID-19 as well as around the Faith Community Initiative Project. Yeah.
There are a lot of contestations between faith issues and medicine, where you find that people with illnesses, when they go to some faith organizations, they are told not to continue taking medication, and that is actually proven to be detrimental to them. How is the situation now with COVID-19?
I think it's always a challenge. I think because a lot of in some communities, the medicine and the faith seem to be on opposite sides of the spectrum, whereas both entities want a healthy human being. So it is a challenge, I think, with some communities maybe not fully comprehending how the COVID-19 is spread and how we can contain the outbreak and how we all need to help contain the outbreak. Yeah,
we have had quite a number of cases on HIV and AIDS where people are told to leave their antiretrovirals, and as an arm that deals with medicines of the faith aspect, how do you deal with those?
So we actually have an intervention that we want to try and implement with the faith communities. So we're looking specifically at the issues around faith healing and non-adherence to treatment with respect to antiretrovirals. So it's something that we want to work with specifically with the faith and traditional communities and leaders, so that we can try and help to teach and talk about it, maybe discuss how we can move forward and people can continue taking their medication and continue being religious.
And Alex in Kwadzana wants to know how effective are homemade masks. Probably if you could just explain to us the proper mask that we're supposed to use.
So the current guideline is just talking about a face covering. So it can be the store-bought, the medical masks, or you can make a homemade mask. It would be effective.
Yeah.
And
we have also seen and read reports that some people are picking up the masks that have been thrown away, and they wash them and resell those to people.
Yeah, so I think it's very important in terms of disposal of those, especially the disposable masks. It's important to make sure maybe you tear it up before you dispose of it, to make sure that it can't be reused in that way, and to also make sure you sanitize and wash your hands afterwards. So yes, so those masks need to be properly disposed of. And if it's the homemade cloth mask, then wash it so often. Yes.
0731168045. That is our number for those that want to send in their questions. Dr. Mandizvidza is here. She will be responding to your questions. And I see another listener here said, why is this COVID being stigmatized? Is it not shaping negative behavior? The stigma with COVID-19, we spoke about this to say that, like you were indicating, some people are saying it's a disease for the old, it's a disease for black people, it's a disease for white people, all that, or for Chinese.
Yeah, I think there have been a lot of reports around that stigma that's being associated with COVID-19 or cases of COVID-19. And it's something that we really have to work on. And I think a lot of it has to do with maybe the way it's been portrayed so far. We're focusing a lot on the death.
Yes.
But you find that there are a lot of recoveries.
People who have recovered,
have recovered from it and are no longer contagious or spreading it to other people. So I think we need to have a bit more positive messaging around COVID-19. We have to help contain the outbreak, but we also don't need to stigmatize those that have COVID-19 or that had COVID-19.
And another listener here is concerned with the way that or the number of people that are being tested. He feels that the number is too low, and wants to know if anything is being done. I think obviously the government will know about this. And another one says, I want to know what is the risk of pregnant women if they are they have contracted COVID-19. This is Africana in Hlongwane.
So currently, there is no evidence to support that there's vertical transmission of COVID-19 from the mother to her child if she's pregnant. There's no evidence currently to support that. But after delivery, there is a risk that a mother could pass on COVID-19 to her child. So the hand hygiene, all those measures that we've been told before, wearing of the face covering, sanitizing or washing your hands before and after touching the baby is also very important, because they can still pass on COVID-19 to the child after delivery. But at the moment, there is no evidence to support that a mother can pass on COVID-19 to her baby during pregnancy.
And there are also issues around young children, especially 5 to 14 years. That says they are not affected by the infection. In other words, they don't get sick. And they then are carriers of the virus. How far true is that?
Children have been contracting the coronavirus. It has been found to have higher complications in the elderly, but children can contract coronavirus.
And get sick.
Yes.
And this is Talent Mbaura in Honde Valley. Is it true that a person who has recovered from COVID-19 will not contract it again? Can you clarify on that?
Like I said before,
still no evidence.
It's something new. It's something that we haven't seen before. So we are, getting evidence as we go along. So at the moment, I have not come across anything that, maybe talks about how immunity after contracting, after recovering from COVID-19.
From COVID-19, yes. And Victor in Bulawayo Bengula West says also that how come we have people that have recovered from the virus? Is there a cure? What medication did they use?
There is no cure at the moment.
Yeah.
So it's a lot of supportive treatment. That's what people are getting. So we
supportive treatment if you
have a fever, they give you something for that. If you're in pain, if you're having difficulty breathing, things like that. So it's more of supportive treatment. That's how they're managing people at the moment. So people can recover from it. I don't think we have quite figured out why some people are dying and not others, why a healthy 30-year-old could also contract the virus. And I think there was like a 90-something-year-old lady in the UK who recovered from it. So I think we're still learning. Unfortunately.
As we are coming to the close of our program, there is also an issue here. Someone says, how soon can patients with HIV get their supplies for more than just 1 month supply, the one that you were talking about earlier?
Okay, so people need to go visit their health facilities. Like I said, you call beforehand, but visit your health facilities and you can collect your medications from there. At least 3 months supply.
And another one says wants to know about the percentage of recovery when someone is infected with coronavirus. Oh, okay. The percentages may not. Let me see if we have another one. If you get recovered, will you get COVID again? You explained about that. So that was going to is our last message from this listener. He wanted to know if you recover from COVID-19, will you be able to get COVID-19 again? And you explained about that. Let me take this opportunity to thank you so much, Dr. Mandizvidza, for coming to the program. And Dr. Mandizvidza is from an organization called the Zimbabwe Association of Church-Related Hospitals. She's a doctor and also a public health specialist. What words, your last words, would you have to the public, especially looking at the pandemic, the coronavirus?
I think I'll just say, wash your hands, wear a face mask in public, don't touch your mouth, nose, or eyes, and maintain physical distancing at all times.
Yeah. Thank you so much, Doc, for your time. My name is Perfect Hlongwane. Let's meet again on other programs.